In this video, we will be discussing the sciatic nerve, which is a crucial nerve that originates from the sacral plexus and is mainly located in the posterior compartment of the thigh. Let's explore its origin, course, and branches. This nerve holds the distinction of being the longest and thickest nerve in the human body, measuring approximately 2 centimeters in diameter. By examining the diagram, we can observe that the sciatic nerve stems from sacral plexus. Notably, it originates from the nerve root values of L4 to S3. So, in simpler words, if you are asked what is the origin of sciatic nerve, state that the sciatic nerve originates from the sacral plexus, which is formed by the fusion of nerve roots from the spinal segments L4 to S3. After its formation, it emerges from the pelvis through the greater sciatic foramen, located below the piriformis muscle, and enters the gluteal region. While traversing the gluteal region, the sciatic nerve crosses the posterior surfaces of several muscles, deep to gluteus maximus. It then enters the posterior thigh by passing beneath the long head of the biceps femoris muscle. Within the posterior thigh, the sciatic nerve sends out branches that supply the hamstring muscles and the adductor magnus. As the sciatic nerve reaches the apex of the popliteal fossa, which is the hollow space located behind the knee joint, it bifurcates into 2 major nerves, the tibial nerve and the common peroneal nerve. This division marks the termination of the sciatic nerve, meaning that the course of sciatic nerve ends here. The tibial nerve continues its course downwards, providing innervation to various muscles in the posterior compartment of the leg and intrinsic muscles of the foot. Meanwhile, the common peroneal nerve takes a separate path, supplying muscles in the anterior and lateral compartments of the leg. The sciatic nerve serves important motor and sensory functions in the lower limb. Motorly, it innervates several key muscles. Muscles, including the biceps femoris, semitendinosus, semimembranosus, and the hamstring portion of the adductor magnus. These muscles are collectively known as hamstring muscles, which play a role in hip extension and knee flexion. As mentioned earlier, after the sciatic nerve bifurcates into the tibial and common fibular nerves in the popliteal fossa, the tibial nerve continues to supply motor innervation to the posterior leg muscles. And common peroneal gives motor innervation to anterior and lateral compartment of leg. So, when talking about the motor function of sciatic nerve, include the function of its terminal branches as well. In terms of sensory function, the sciatic nerve does not have any direct cutaneous functions. It does provide indirect sensory innervation via its terminal branches. The tibial and common fibular branches of the sciatic nerve contribute to sensory innervation in different areas of the leg. Specifically, tibial nerve supplies the skin of the posterolateral leg, lateral foot, and the sole of the foot, as shown here in highlighted areas. As for the common peroneal nerve, it supplies the skin of the lateral leg and the dorsum of the foot. Now that you are familiar with the course, motor, and sensory function of the sciatic nerve, you can better understand that in cases of sciatic nerve damage or compression, there can be motor and sensory deficits. Motor deficits may present as muscle weakness or paralysis, while sensory deficits can lead to altered or loss of sensation, such as numbness or tingling. So, let's delve into its clinical significance, particularly in the context of a common condition known as sciatica. Sciatica refers to a condition characterized by pain, numbness, and weakness that radiates along the path of the sciatic nerve, which extends from the lower back through the hips and down the legs. Let's explore some of the underlying factors that can lead to sciatica. These conditions include a herniated disc, spinal stenosis, and degenerative disc disease. Imagine your spinal disc as a cushion between the vertebrae in your spine. In the case of a herniated disc, the soft inner portion of the disc protrudes or bulges out, like a jelly-filled donut that has been squished. This bulging disc can then apply pressure on the sciatic nerve, causing the characteristic symptoms of sciatica. Now, let's focus on spinal stenosis. Picture your spinal canal, which is the hollow passage that houses the spinal cord and nerves. In spinal stenosis, this canal becomes narrower, often due to factors like bone spurs or thickened ligaments. As a result, the reduced space can squeeze or compress the sciatic nerve, leading to the development of sciatica symptoms. Lastly, let's discuss degenerative disc disease. Over time, our intervertebral discs can experience wear and tear. They may lose their normal structure and become less flexible, resulting in degeneration. When these discs degenerate, they can cause inflammation and irritation of the adjacent nerve roots, including the sciatic nerve. Understanding these underlying factors helps us grasp the reasons behind the occurrence of sciatica. By recognizing the mechanisms involved, healthcare professionals can develop appropriate treatment plans and provide effective care for patients experiencing sciatic nerve-related symptoms. Common symptoms of sciatica range from mild to severe and can manifest as sharp or burning pain, tingling, or numbness in the lower back, hip, or leg. Muscle weakness may also be present, and in severe cases, standing or walking may become challenging. Another common condition related to the sciatic nerve is piriformis syndrome. The piriformis muscle is a small, deep muscle located in the buttocks region. It originates from the sacrum, the triangular bone at the base of the spine, and attaches to the upper part of the femur. The piriformis muscle plays a role in the rotation and stabilization of the hip joint. Piriformis syndrome is a condition that involves the piriformis muscle. In some individuals, the sciatic nerve can pass through or underneath the piriformis muscle. In piriformis syndrome, this muscle can become tight or experience spasms. When the piriformis muscle tightens or spasms, it can compress or irritate the adjacent sciatic nerve, leading to symptoms that are like those of sciatica. The compression or irritation of the sciatic nerve in piriformis syndrome can cause pain, numbness, or tingling sensations that typically originate in the buttocks and may radiate down the back of the thigh, and in some cases, extend all the way down to the foot. These symptoms can be worsened by activities that involve prolonged sitting, running, or movements that engage the piriformis muscle. You might be wondering how to differentiate between sciatica and piriformis syndrome, given their similar presentations. The short answer to this question is that, as we have discussed, sciatica is primarily caused by spinal issues such as disc herniation or spinal stenosis, whereas piriformis syndrome is related to muscle involvement rather than spinal conditions. The pain pattern also differs between the two conditions, with sciatica typically exhibiting pain radiating from the lower back to the lower leg, while piriformis syndrome tends to cause more localized pain in the gluteal region and buttocks and only a mild pain in lower extremity in rare cases. That is all about the sciatic nerve. Lastly, let's look at its terminal branches, the tibial and common peroneal nerves.
Discover a wealth of accurate, up-to-date medical videos for in-depth learning, anytime, anywhere. Elevate your medical expertise with sqadia.com.